just to, I guess maybe to recap, when I met with you originally, we talked about possibly trying to pursue some type of screening for genetic causes of Parkinsonism. Can you just remind me, did we ever get that arranged through any lab or research study? Okay. And then can you also remind me, your brother's diagnosis, was it confirmed with some kind of an autopsy or brain donation program? Or hard to say. Okay. And when did he pass away? 2 years ago in June?
Yeah.
Okay. And was he seen at an academic neurology center? Ohio? Okay. All right. It's something where with a diagnosis of dementia with Lewy bodies, if it's not confirmed based on certain kind of formal criteria or based on brain donation, I myself have had instances where I diagnose someone with dementia with Lewy bodies and then it turns out to be PSP or vice versa. So it would be valuable to still try to arrange some release of records for review or to confirm if he had some type of autopsy confirmation. Could be hard.
Yeah, she can ask her sister-in-law.
Okay. Sounds like a plan. As far as you know, did you have any cousins, so basically, descendants of your aunts or uncles? Or did you have any parents, aunts or uncles that had anything like Lewy body or PSP? And then how many siblings did you have? Just the one. And then when we met through the telemedicine, it sounded like the trospium was helping with the bladder symptoms, but then you developed some side effect that you had messaged me about. So we had added senna for that, the laxative. Are you using a laxative, an over-the-counter laxative now? And is that helping? And then have you had any falls recently?
One.
And what were the circumstances?
She was putting the cane on the bed and she turned and tripped.
Okay. And then you always use a cane? Okay. Do you ever use a walker? And then in terms of balance exercises that you learned from physical therapy, do you have a program that you're following now? And have you been doing any physical therapy recently? Do you have a program close to home that you would feel comfortable going to again? Let's see. So close to home for you would be more...
Oh, they right there in
Entire care.
In the village.
Yeah.
It's a 5-minute drive.
Does it need to be a certain type of physical therapy office?
Ideally, it's one where they're comfortable working with people who have Parkinson's or Parkinsonism.
I believe they do a pretty good job there.
I agree. I think the entire care program, we have a history of having many patients in common. So occasionally they'll recommend their Cottonwood location for specific situations, but I think they have quite a few therapists that are skilled with these conditions. And Sedona is a lot closer. It would be much closer to have it right there in the village. Yeah.
So the question would be, we don't know if she can, with Medicare paying for it right now, or if we have to wait until it reboots or restarts again.
Right. The last time you did a course of physical therapy was when?
Last spring, right? It's been several months.
Okay, so it's spring of this year.
Yeah.
Sometimes if I just say there's a new
Or
problem.
winter perhaps, it's been a while.
Okay, it'll be worth just submitting it and trying to document that there's a new problem that you got, I can say you got worse. And then the important thing is that they give you a list of exercises to help try to preserve balance.
She has gotten worse, so that's true.
Yeah, so most likely they would cover it because of that. So either worsening or new issue. Now, have you noticed any problems with swallowing, choking on food or drink? A tendency to laugh or cry, and I don't just mean the runny eyes, but laugh or cry when you don't mean to. So involuntary emotional expression, not an issue. Okay. Trouble sleeping. Any problems with excessive drooling?
Yeah.
Some, but that's not gotten worse, I don't think. I mean, it got worse than it was, say, 3 years ago, but I haven't noticed it.
It's worse than when I was here last, which is roughly a year ago.
Okay.
So
So it's gotten a little worse.
And when we spoke before, when we first met, you told me it was present, but it wasn't problematic. It's not irritating the face or causing you to choke when you're laying on your back at night. Okay. So I wanted to double check a couple things on your physical exam. I got you here in person again. And this is helpful for everyone to observe too. So I'll just, so the idea is I want you to relax in the chair, and then I'm gonna have you try to follow my finger with your eyes. So try to follow the finger. Okay, and then try to follow my finger down, and then up. And then look back and forth between my two fingers, back and forth. You want to watch this. So try to look back and forth from my index to my thumb, back and forth, and then up and down between the two. Now look at my finger, now look down at the floor, back to my finger, up at the ceiling, back to my finger, up at the ceiling. You see, it kind of goes around. So we call it the round the houses sign. Look at my finger. Now look at the ceiling. Finger, ceiling, finger. Just a little bit of slowing with the up and down movements. Now just try to focus on my finger, but without turning. Try to watch my finger. You notice your eyes sometimes close when you don't want them to? It's just because they're dry. Okay. And then can you hold your hand steady as you can, then touch my finger, and then touch your nose and go back and forth. And then with the other hand. And then with the right hand, open and close like that, as wide and fast as you can. And then the other hand, something. And then with the right hand, open, close, fast as you can. And then the left. And then with the right hand, palm up, palm down, fast as you can. And then the left. And then with the right foot, just tap fast as you can. And then the left. And what I'm seeing is it's a lot harder to do repetitive movements in the feet than in the hands. And then that right toe wants to kind of go up on its own. Okay. Now I want to see if your arms are folded. Can you rise from the chair? Oops. Okay. And then arms at your sides. I want to just go out in the hall with you and watch you walk.
Sometimes she needs a whole doctor.
Okay.
do you want me to help her?
So
It says ready, examiner 6.
I think they do all of them at kind of different.
This is excellent compared to usual.
They're a little bit
Yeah.
different. This one's the most active. Yeah.
okay, now show me how you do. Turn it around. And then come on back. get to here, I'm going to test your balance by pulling you backwards. So the idea is I want you to be standing right here in the middle of the hallway facing away from me. So you can't use your arms to catch yourself. A lot of freezing on the turns there. See that? Freezing of gait. Think about marching to a marching band tune. Sometimes that can
Unstick.
And then take a step forward with the right foot. Okay. And then I'm gonna pull you backwards. I'm gonna catch you if I need to, but I want you to try to catch yourself. Okay?
Yeah, just let us
A little
know.
harder now.
Give us enough notice though, because she booked up.
Probably one more time. Oh, good. All right, I'll let you carefully take your seat. So you can appreciate much more lower body Parkinsonism, very little upper. And then the down gaze palsy, responsibility. She has more of a, we call it a Richardson syndrome type picture when it's more of a classic triad.
This is how she moves in the house, around the house, like this.
What I might talk to her about is also amantadine sometimes helps deep freezing.
Okay.
Not everyone tolerates, but that's something we'll talk about, pros and cons of.
Okay. I'll hop into this room to see.
Okay, yeah, they're ready for you.
Okay, great.
Okay. So,
Yeah, she was here.
did you see your uncle towards the end? Or
Did I see what?
Did you get to see your uncle at all when he was?
My
Her
uncle.
brother that died.
Yeah.
Oh, no, not at the end. No.
Did you see him early on? Did you see
Early
him?
on, yeah.
Okay. Do you know anything about what his symptoms were?
I just know he was diagnosed with Lewy body, but I don't even know where he was being treated. Sorry.
Yeah.
But I can help find out.
So he does have 2 daughters, and their observation, because we went out to dinner with one
Right.
a year ago, was that her walking now is similar to his walking way back when he
Yeah.
first started having problems.
Right. It's just sometimes with with these type of symptoms, these fit more with a condition called progressive supranuclear palsy or PSP.
I'm familiar.
Familiar.
It's all good.
Yeah.
You can see. You can go forward with that.
Yeah. So we would call, what I was saying to our medical student, it fits more with Richardson syndrome, meaning the more classic features where you have all the classic triad of trouble looking up and down, the vertical gaze palsy, atypical Parkinsonism, where there are features that aren't typical for Parkinson's, like pure lower body symptoms primarily, and poor response to medication. This medication is not doing a lot for your gait freezing. And then the third feature is the early severe postural instability, where you're very unsteady on your feet, or you have trouble catching yourself on that full test. What can happen though is sometimes it starts with a frontotemporal dementia and can be misdiagnosed as Lewy body dementia. And what we're finding in my brain bank, I have 2 people that I've kind of been back and forth about diagnosis, and first call it PSP and then call it Lewy body, or in one case call it Lewy body from the start because they had hallucinations. And then it turns out because people with PSP can also have Alzheimer's, somehow the Alzheimer bring out the hallucination. So there's all these things that aren't in the textbook that we're still learning about the brain and these brain conditions.
May I interrupt for a second? You had a fall in Colorado, and you hit your head, and you tell me if I'm wrong, you spent an overnight in the hospital there, and they did a variety of tests, and there was frontal lobe something damage or something.
Degeneration. Usually what we see on the image, on the scan, is there'll be degeneration of the frontal lobe.
You don't remember this? And when at Cheryl?
So,
What am I getting wrong?
What happened is she took the Robidopa, then no food, and she got faint.
Make you feel lightheaded.
Quite
Okay.
faint.
Yeah.
Okay.
Didn't lose conscience, but quite faint. And then her daughter called 911 and they did a series of tests at the hospital and
Right.
didn't find anything wrong and spent the night. And the nurse while we were there said they find out a lot that people who are taking that pill, they don't eat breakfast, they get faint.
Cheryl's told me something though about frontal lobe.
She never hit her head.
Okay, but maybe it's in the X-rays or something, and I'm not sure that's important. You mentioned frontal lobe, so I wanted to bring it up.
Yes, what I mean to say is PSP causes a degeneration of the frontal lobe.
Okay.
So people will have, in some cases, a dementia problem where they have problems with language or changes in behavior.
Okay.
And so in some cases, they may be diagnosed with Lewy body dementia because of the early dementia plus the Parkinsonian symptoms. But under the microscope, if they sign up for brain donation and they want their family to know for sure what they have, we actually see a completely different pathology. So there's these tau aggregates in the brain rather than Lewy body.
Right.
And this just happened to me, someone that I diagnosed in your part of the state based on some of the features of Lewy body because there were hallucinations but in early dementia, but then followed her remotely, like trying to save you the trip from Northern Arizona, and then turns out it's PSP plus Alzheimer's. So what I'm saying is there's a possibility you could have a genetic predisposition in the family, and there are two main reasons why that could happen. So one reason is there's a gene called the LRRK2 mutation, which can cause either a Lewy body disorder or a tauopathy, even within two different pairs of identical twins. So that mutation, called LRRK2, is the most common risk gene for Parkinson's and Parkinsonism. So that is a gene that is available that we can do as part of a genetic test panel. The other gene that can cause hereditary forms of progressive supranuclear palsy is a mutation in the tau genes, TAU. There also are other genes that can cause hereditary Parkinsonism, but those genes tend to cause a variety of symptoms. Some people have motor neuron disease, some people have the Parkinsonism. So there is a gene that's been linked both with motor neuron disease and Parkinsonism called C9ORF72. So bottom line is there would be some value to getting some screening for some of these commonly known risk genes, because if there is a risk gene that you and your brother had, and so if you have the gene, we would have to assume your brother had it as well, then this would be relevant to either of your descendants and their children, because research that's going on right now could actually lead to preventive therapies for future generations. So it may not necessarily lead to a treatment for you, but for future generations of the family. So I look at genetic testing as something that's important for families,
Yes.
even though it isn't likely to lead to a different treatment in how we take care of you. I would still take care of you the way I would any of my patients with PSP.
What does PSP stand for?
Progressive supranuclear palsy. The reason that term was coined is it refers to a part of the brain above the superior, or above the red nucleus, so superior colliculus. So it's a medical term of the area that is degenerating, that's causing a palsy or a weakness in the eye movements in the vertical gaze. So the term was coined to describe the eye movement problem, but there's a whole lot more to it, and many people, the eye movement problem is the least of the problems. It's a confusing term because it's also the abbreviation for the PlayStation. So
It is.
it's like that's the PSP you'd rather have.
Yes. Is genetic testing a prescription thing or something you just pursue on your own?
So it's something that I can order as a test panel. However, there also is a research program through the Parkinson's Foundation that includes screening for some of the more commonly known risk genes. In your case, because that may not include the other genes I'm thinking about, it might be worth looking at just screening for kind of that short list that would be relevant to you. Are you open to doing some genetic testing if it weren't covered by insurance? If there's an out-of-pocket cost, is that something you'd be open to?
How much would it cost?
That's something we'd have to clarify with the company.
Mom, I'm sure Jim and Cheryl would want you to do that because they would want to know for both themselves and their kids.
Yeah, but I can look into that, and then you'll get a determination from your insurance whether it's covered, and then if it's not, then the company would tell you what the costs are.
And then she would, come down to Phoenix and take blood tests, or how does that?
Usually they just send you a saliva kit in the mail. You just, put a saliva sample and send it out.
That's easy.
It's like
Oh,
doing
yeah.
it's like doing like genealogy.
I would think that cost would be rather minimal, at least that part of it.
Yeah, let me look into it and just determine which of the companies, which of the clinical labs that do these tests includes all the genes that I think are relevant to you. And then I would just, we could set up a telemedicine meeting if any of them show a positive hit. We could set up a team meeting with you and your family for me to discuss it. But we use a telemedicine platform that allows multiple parties to join.
Right.
So as long as the patient is in the state of Arizona, I'm allowed to do it, but family members can join from anywhere in the
From
world.
France? Good.
From France, yeah.
Good.
They can. Okay. The other symptom I was concerned about is just the balance and being proactive to do everything we can to prevent injuries from falls is the best option. I find the medication isn't often very effective. However, there is a subset of individuals whose gait freezing does seem to improve with amantadine. Amantadine is another medication that's used to treat symptoms of Parkinson's. It was originally developed as an antiviral. One of the main pitfalls to using amantadine is it could worsen the constipation issue, just like levodopa can. And so I would want you to still adjust your dosing of the laxative and increase the dose to add another pill or two per day if that emerged while taking amantadine. What I would have you do is just start 1 pill a day every morning and then go up to twice a day, morning and afternoon. So with your first 2 doses of carbidopa, levodopa. I find that some people, if they take it at night, it can cause insomnia. So I would hold off on going above 2 a day. Because your last dose is usually towards the end of the day, right? For some reason, capsules are less expensive than tablets. So I'm gonna order capsules, but if that changes and tablets are cheaper, we'll order tablets. In people with Parkinson's disease, they can sometimes develop hallucinations as a side effect from amantadine, but that's very unusual with PSP. Some people just tell me they don't like how they feel with amantadine, and if that happens and it's not helping the gait freezing, then we can always back off of it and just stop taking.
How long would it take to kind of notice a difference if you were trying to figure that out?
I would give it at least a month or 2 at the twice a day dose. And if you're tolerating it well, but we're just not sure we're seeing enough improvement, we might consider increasing the dose further. So you game to try the amantadine? And then also, if we can, we'll arrange that physical therapy.
How about occupational therapy as well?
And what are your goals with that? Are you looking to get a little
Well,
bit more?
it's my understanding that that helps in everyday practice of reaching for a cup or a glass or putting the dishes away or things like that.
Yeah, so if you're having trouble with your everyday activities, they might be able to give you some tips on how to compensate for your symptoms.
Are you having trouble with that?
Disagree, but it's your choice, Mom, but I think you are. And I'm sorry, I'm just being honest with the doctor. I think you have plenty of strength, but to physically do things, like, for example, reaching and putting dishes away and things like that, you have the strength to carry the weight. So I think, but I think there's things that you're not doing, and perhaps it's just because it's easier not to, or you don't want to fall or whatever, but that's where I kind of think occupational therapy might help.
Yeah, thanks for mentioning it. So what I'll put in the referral request for both. Just to clarify the prescription, which pharmacy do you want me to send a new prescription to? In the center allow 30 days when you're starting something new, or does it have to be 90 days?
For
The new one, the amantadine.
before they'll fill it?
Some mail order require 90
I don't
days.
think I haven't noticed any problem with that.
Okay.
Can we go back to therapies for a minute too?
Mhm.
Speech therapy has stopped, and it seemed to be helpful. Can it be restarted?
Usually with speech therapy, they will cover up to 8 weeks of therapy, and then they give you a list of exercises to continue on your own.
Okay.
So like with physical therapy, we have to document worsening or a new problem.
Okay.
For example, some people will have language difficulty and they'll do speech and language therapy, helping them kind of work around that trouble coming up with words.
That's
As
not.
opposed to
yeah,
the
that's not a problem.
hypophonia,
Okay.
low volume of voice.
Okay.
So what I'm going to do is I'll put it in as a physical occupational therapy referral to work on the gait freezing. So it's a new problem. And it's to to Entire Care Sedona. And you already have their number, so you can call them to reschedule? It'll be the same one you've been before.
So Mom has at least one more thing to talk about or ask about.
Mm-hmm.
Yeah, she found the numbers.
You said there was one other thing you wanted to talk about?
Do you want me to talk about it? Not if you agree or tell me if I'm wrong. But there's, because of the kind of losing some abilities or permissions, let's say, to drive or to do things, when more and more is taken away for whatever reason. So there's some frustration, anxiety, maybe some impulsive behavior a little bit, maybe some fixation, things like that. And Mom, if you disagree, we talked about this yesterday, but if you think I'm off base, you just need to say so. and we were just sort of wondering, first of all, I guess, medication-wise, or even homeopathics or something like that, or diet or anything, if that might be helpful, or if there's meditation or something that might be helpful, or I don't know, maybe even just a suggestion from you for what we could maybe do about that.
So PSP does sometimes cause people to be a little bit more impulsive or to kind of do things without thinking it through. And in my experience, there isn't medication that addresses it, but kind of counseling, people that are with you, that are keeping an eye on things, counseling your family about what we call the non-medical strategies to coping with these changes are kind of the standard of care.
Okay.
We have social workers in our group that do have a lot of experience counseling people on that. They also offer telemedicine, so it's something where...
Are they counseling my mom, or are they counseling the caregivers?
Well, it's more for the caregivers,
Okay.
because with PSP, even though you should be doing things a certain way, it just doesn't happen. I have people all the time where they know they're supposed to wait for someone to help them out of the car, and then they go in to get their keys and they find them on the ground next to the truck. So it's more coaching people on strategies to plan for those behavioral changes or cope with them and to work with them.
Okay.
But the medications generally just cause side effects. They don't necessarily improve it. That said, if you find that you're irritable or you're anxious or depressed, sometimes antidepressants have a role, but that's not what I'm hearing.
No, I don't think it's depressing, for example, to not be able to drive or to not travel on a plane or things like that. That's certainly depressing and frustrating. But what do you think about being just kind of depressed? What do you think? Anxious, yeah. I can provide an example. Mom, let me know. On the computer, there's been several financial transactions that have been difficult for one reason or another. And I think you get quite frustrated and upset about that. And it takes you many, many phone calls or texts or maybe even a lot of time to it's kind of like you...
She's getting scammed.
Well, and you kind of focus and kind of lose the ability to step back and say, oh, maybe I could do this, or maybe I should stop and call somebody, or whatever, that kind of thing. And I think that's what happens, but...
Yeah, we may have to keep an eye on those things, because if you're doing those things...
We've adjusted, but I think it's frustrating because she allowed herself to get scammed, and now she can't go walk like she used to. When I was at work 2 years ago, she'd go walk around the block 3 or 4 times by herself. And she can't do that anymore. So that's frustrating, and then allowing herself to be scammed like that.
Yeah.
Has been frustrating.
Yeah, a lot of this kind of loss of independence and just the way it changes you is very frustrating. So I would recommend still scheduling, separate kind of check-ins with our social worker, both for you and for your family, to talk through these kind of things.
Okay, thank you.
We had something coming up on the 15th.
It's soon. The 15th sounds right, but I think that's
that
the
is
initial.
social
Yes, that's the initial appointment, and I don't know what to expect.
So she'll explain kind of what her role is, but these are the kind of things that she can kind of talk you through.
Excellent. Thank you.
So she will schedule in follow-up visits after?
Right. So we'll schedule additional telemedicine follow-up with me, and then the social worker, I would recommend asking her to schedule more follow-ups.
Okay.
Sometimes she leaves it open to you per request, but I would recommend doing more than one.
Yeah.
Okay.
So I'm glad to see that is on the schedule for next week.
Good. And typically my mom is home by herself for parts of the day, like the morning and the afternoon and things like that. And there's no one else in the home. I just want to get a feeling for where you think we're at with that situation.
Yeah, I mean, you're still, your frequency of falls is still relatively low. That's good to see. But I think we should be planning ahead that in the near future, unless we see a dramatic improvement in that freezing of gait, it might not be safe for you to be by yourself, because there won't be anyone to kind of help if you hurt yourself with a fall, if there's a major injury.
She does have the Apple Watch, and when she did fall or trip
Right.
a couple months ago, it like set off this alarm, and she had
Yeah.
could have then called
Yeah.
whomever had set up.
Right, but you don't want to, like, every time she falls, she might get to the point where she's falling twice a day.
Yeah, no, that's
And
not-
you don't want 911 to come every time she falls,
Right.
you know. But that would be the backstop measures. At least, you know, if that alarm goes off and you're out of the house, you have some system where someone can check on her right away, or, you know. But that's where you would have to be the judge if there's a head bump, and then you do have to get her to the hospital to be evaluated.
Yeah.
But most falls, that's not the case.
Yeah.
So PSP, there is a website, it's just psp.org.
We have it, yeah.
So that is a great resource just to talk through a lot of the symptoms that we're watching for. But I would appreciate if you can fill me in once you've talked to family about what your brother's symptoms were, or if there was a formal confirmation of diagnosis that was made, because that would help me guide you as to results of the genetic testing.
Could you head that up, Julie?
Yes, of course.
Either
Be
through
happy to.
Cheryl or
I'd be happy to, yes, of course. So,
Well,
thank
thanks for arranging
you.
this. This is